I think combining spring allergies and sleep apnea, it's make it even harder for the patient with a sleep apnea problem to have a deep sleep. Basically, the effect of that would be the patient is becoming restless. They are not able to focus. It changes their behavior. So ultimately, it changes the way that the growth and the alignment of the teeth looks like on that patient. Yes, if a patient has a sleep apnea problem, basically we can see that in a younger patient in their growth and development, we can see the behavioral change. We can see that how focused those patients, they are tired all the time. As far as the teeth, we see the malalignment of the teeth, especially in the front teeth, anterior teeth. This is obvious to the orthodontist and to the dentist to see that. When the patient has a sleep apnea, basically a dentist or orthodontist by the shape of the face, the way that the alignment of the teeth and how the jaw looks like. Usually the patient with the sleep apnea problem and sleep problem, they have a narrower jaw, they have the anterior teeth are crowded and the face looks narrower and longer. So these are the observations that the dentist or the orthodontist can have early detection of the sleep apnea. Usually the patient, they have a misconception about the treatment of a sleep apnea and the fear of the treatment because they feel that it's a complicated, costly treatment. But the reality is that these days the sleep apnea can be treated with a small orthodontic appliances rather than that CPAP machines and a bulky to carry equipment. And also most of the medical insurance, they accept to cover the cost of the treatment, which it kind of concerns some patient to looking for the treatment. The patient that they have a CPAP machine, also they benefit from orthodontic expander and also an orthodontic appliance that helps to bring the lower jaw forward and it creates more airway that makes it easier for the patient on the breathing. So there are two smaller orthodontic appliances that a patient can benefit from having those appliances rather than the CPAP machine. For a younger patient, basically the sleep apnea treatment can help their growth. We see sometimes the patient at the early age, they are at 30-40 percentile of their growth chart, but after having that treatment, they immediately after 3-4 months, they go into the 70% or 80% on that growth chart. Also, it makes the patient to be more focused, a better behavior. They are not tired all the time. So it's kind of life-changing for the patient that they are suffering from sleep apnea. The sleep apnea consultation process starts with the orthodontist doing the clinical evaluation of how the teeth looks like, how the face looks like, the adenoid, and then in order to have a kind of a more accurate study, we ask the patient to do basically a sleep apnea study that there are centers that we refer the patient and they use some monitoring devices, remote monitoring devices. These devices basically checking the pattern of the sleep, the level of the oxygen intake, and based on the severity of the case, we recommend treatment options for the patient.